Joining us online is Dr. Robert Walker, professor and chair of the Department of Medicine at the University of California, San Francisco, who's president of the Society of Hospital Medicine, chair of the American Board of Internal Medicine, and author of about 300 articles and 6 books. In 2015, Modern Healthcare ranked him as the most influential physician executive in the United States. Dr. Walker, thank you so much for your time. Really appreciate it.
It's a great pleasure. Thank you for having me.
So yesterday, you were tweeting about the flattening of the curve in San Francisco. What do you see in San Francisco? Obviously, it was a place where there was a lot of wide-scale worry about significant outbreaks that would overwhelm the healthcare system. You're tweeting some optimistic numbers from San Francisco. What does it look like up there?
Yeah, the numbers we're seeing here are remarkable, particularly when compared with New York and some of the other parts of the country where things are breaking out. We have had a total of just under 400 cases in San Francisco. By contrast, New York is now over 40,000. And we've had a total of 6 deaths in San Francisco from COVID, and New York is in the high 900s, maybe over 1,000 today. And what's amazing about that is 2.5 weeks ago, we had exactly the same number of cases as New York. So this has had a very different trajectory out here, and we're incredibly sad about New York and some of the other parts of the country, but very thankful for what we've seen here.
And Dr. Walker, why do you think it is that San Francisco has seen such a different trajectory? Because they started to take social distancing measures about the same time as New York. We down here in Los Angeles started to take those social distancing measures pretty quickly, like right after the announcements from San Francisco, yet we're seeing a pretty significant uptick in the number of cases. What do you think the differential rates are coming from?
Yeah, it's hard to know exactly, but we were early in not only sort of general instructions for people to do social distancing, but policy pronouncements. So our city and the 6 Bay Area cities and counties went to essentially full stay-at-home orders on March 16th, and the state of California went on March 19th, which was several days before most of the rest of the country. It may turn out to be just as importantly, if you think about the big industry in San Francisco, the biggest one is the tech industry. And the leaders of the tech businesses, Google, Facebook, and others, basically told all their employees to stay home as early as March 5th. And so the zeitgeist out here was one in which it was both orders from the government as well as the major corporations telling people to stay home about a week before many of the other parts of the country. And so that, and I think some of it is just luck, but it turns out that days make a difference. And, this thing can grow exponentially so quickly that if you get moving on keeping your distance and staying at home, even as much as 3 or as little as 3 to 5 days earlier, it may make a huge difference in the overall trajectory. And I think that's what we're seeing.
I'm speaking to Dr. Robert Walker, professor and chair of the Department of Medicine at the University of California, San Francisco. So, Dr. Walker, I don't know if you've had a chance to examine any of the various models that are being bandied about as to the death rate of coronavirus and the possibility of what the sort of exponential growth curve looks like, the flattening of the curve. There's been the Imperial College study. There was that study out of the University of Washington that's now being cited by folks from the White House that suggests, according to Dr. Fauci and Dr. Birx, that even if we engage in social distancing and these sort of lockdowns for a prolonged period of time, we may see 100,000 to 200,000 deaths. What do you make of the models, and how effective do you think, for how long can the social distancing be? Because one of the questions here is what happens when people start to gradually be released into the economy. It doesn't seem like we have sort of a date certain as to when the medical resources are going to be available such that a surge in cases is not going to overwhelm the system.
Yeah, I mean, the models are as good as we can do now, but they all have substantial uncertainty associated with them. The evidence is pretty clear, though, that social distancing and shelter-at-home orders really work quite effectively. There was a study out of Italy where 2 regions next to each other in the Milan area, one went to early social distancing and the other later, and the curves are just night and day. One has a very big peak and the other is much flatter. So it's pretty clear that the recommendations of the infection experts are right. The problem with social distancing and with shelter-in-place orders is the outcomes of what had happened before them are kind of baked in. So what had happened in the week or 2 before people started separating themselves, that's going to play itself out no matter what you do now. Now, it doesn't mean you shouldn't be incredibly aggressive now because it keeps going unless you you separate people. But it's not like it's magic, and the day you do it, you stop seeing new cases. You will see the cases that got infected from a week or two before. I think what the models seem like they're accurate to me and to my colleagues that study this for a living. It looks like we're on a trajectory for many tens of thousands, if not 100,000 or 200,000 deaths. And whether that number gets any higher really depends on whether we can do the social distancing and stick with it for a period of time. Now, what happens when we start coming out of it? That's going to be a very tricky phase. And Scott Gottlieb, the former FDA secretary, has put out a set of policy recommendations that I think are quite smart, because it's going to die down. It probably is going to happen in different communities sooner and later, but it seems like many of them, it will peak in the middle of April and maybe begin dying down in May. It's not going to be gone. And so I liken this to a fire that you may have extinguished the main fire, but there's still embers around. And then we have to engage in really aggressive testing and public health strategies to be sure that we catch any new cases early, isolate them, and keep this thing tamped down. But it's not until we reach that point, and that's likely to be in May, that we can begin thinking about relaxing the kind of restrictions we've had.
This is Dr. Robert Walker, professor and chair of the Department of Medicine at the University of California, San Francisco. So speaking of those measures that are going to have to be taken, South Korea had built up for these measures in the aftermath of the SARS epidemic in 2003. It took them literally years to build those sorts of resources so they could do what they've been doing in South Korea. Now we're talking about having to build not only testing resources, but surveillance resources that could be activated in a matter of a couple months. I'm not supremely optimistic that we're going to have those measures in place, given how long it's taken just to get basic testing approved via the FDA. Even now, we're struggling to get those tests out. So with that said, realistically speaking, how long do you think it will be before most Americans can go back to work? Not just a few waves and people who have already maybe been tested for antibodies, but like actually most Americans able to go back to their offices?
Ben, it's so hard to know, but some of that depends on the adequacy of the public health response, and that's everything from testing to other public health maneuvers. It probably is going to vary by community. So, places that were hard hit may see a very early peak and surge, and then they may come down fairly quickly. That's what we saw in China, for example. And some of it depends on something we don't quite know yet, whether this thing is seasonal. So it may be that it's dying out on its own in May or thereabouts, and that may change the tempo at which we can allow people to go back to work and go back to what resembles a normal life. The problem, of course, if it's seasonal, there's a good part of that and a bad part of that, which means it might come roaring back in the fall, as happened in the Spanish flu epidemic. But that will at least give us a little bit of time and bandwidth to continue to work on therapies, to build the testing capacity, to work on the other things we need to do to keep this thing tamped down and prepare ourselves for the possibility that we're going to do Act 2 of this sometime in the fall.
Dr. Wachter, there's been pretty wide consensus across the political spectrum that this needs to happen. There needs to be these tremendous lockdowns. Obviously, the Trump administration is on the same page as everybody else when it comes to that. There are some critics who suggest that we should have been implementing measures like the Swedes or like the Netherlands that are a fair bit more loose. Why do you think that those wouldn't have worked in the United States? And how do we sort of develop a null hypothesis here, given the fact that everyone is basically engaging in the same measures? And so if we succeed and the deaths are down, and that is accredited to the staying inside, there are going to be some people who say, well, we did too much, and actually we shouldn't have done any of this at all.
Well, I think it's very hard to see what's going on in New York and say that we've done too much. And even in the places that have put out statewide or regional proclamations that people should stay inside, the degree of adherence to that and enforcement of that varies a lot. It's not just that you have to have the order. It has to be everybody's got to understand, and it's got to be messaged constantly that this is the right thing to do. It's brutally hard. I mean, the impact on the economy is real and is devastating in its own way. But to my mind, this thing is we've never seen anything quite like it in our lifetime, and certainly in my medical lifetime of 35 years. And we can't do anything, including get the economy back on track, until we get this thing tamped down to a manageable level. So I have very little sympathy to the arguments that we should be doing less. I think if you look at San Francisco versus New York, I think it really supports the hypothesis that being aggressive about this early, not just from the public sector and the government sector, but from the corporate sector, pays massive dividends. And I suspect that will have a big impact on the economy ultimately if we manage to keep this to a more manageable level. So I think we got to be super aggressive about it. We can't let our guard down anytime soon until the public health experts say that it's safe for us to do so. And I think that's not only the best treatment and prescription for the health aspects of it, it actually ultimately is the best prescription for the economy.
Obviously, I agree. And I think that's why it's important to sort of knock down some of the arguments that are being put up there by folks who may be encouraging a loosening before it's time. Dr. Wachter, final question for you. Obviously, this has stopped the entire world economy dead. The sort of second order effects here are going to be horrific. We've already seen that they're saying there could be 47 million Americans out of work as soon as the next few weeks, 32% of the American public unemployed. Is this going to become sort of a regular feature of life now, or is this sort of a once in a century thing? None of us foresaw this. There were failures to foresee. I think that there are many warnings that were given to federal and state governments. They needed to be ready for this sort of stuff, and nobody ever thinks about the black swan event until it actually happens. But perhaps we should start thinking about those things sooner. Is it going to be a regular feature that every 5 years a wet market is going to set loose a pandemic that decimates the entire world economy?
I think your crystal ball is as good as mine. I think what we've seen in the last several years is that SARS and MERS and other things. We've seen stuff that could have been this, except some of the characteristics of the viruses were a little bit more benign, not quite as contagious, or there are other very subtle things about the virus that influence how rapidly it will spread. Whether we're going to have anything like this again in the next 5 or 10 years, that feels unlikely, just probabilistically, but we now know what it looks like, how it can happen. And I think that if we don't take this as a lesson to be better prepared for the next time, then shame on us. We really have to, this has made clear how devastating this can be. This is not theoretical. It's very real, and it not only has massive economic effects, it has unbelievably tragic health effects. So we have to take this seriously and be ready to push a button the next time it begins to be happening and roll out the playbook, which we did not do this time.
Dr. Robert Wachter, Professor, Chair of the Department of Medicine, University of California, San Francisco. Really appreciate your time and your insight, and hopefully, with the help of medical professionals like you and with the help of God, everybody looks more like San Francisco than like New York in the near future.
Thanks very much. Thanks for having me.
I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.